This video, entitled Successful TMD Treatment, is provided to you by the Atlanta TMD Institute. My name is Dr. Mark Allen Podolsky, and I'm the director and founder of the Atlanta TMD Institute. I just want to let you know that the Institute was founded to educate dental and medical professionals in TMD and patients. So you're being educated now by the Atlanta TMD Institute to develop knowledge of temporomandibular disorders, and there is just so much related to this disorder. It's just overwhelming as the years go on how we see the relationships of TMD to the entire body. And we need to elucidate, clarify, and bring all this information out so treatment can be improved. And finally, the third purpose of the Atlanta TMD Institute is to successfully treat patients suffering with TMD. And we do treat patients of all types, referred from physicians, dentists, in the entire Southeastern United States. And believe it or not, other TMD specialists have sent their patients to the Atlanta TMD Institute. So this video is titled TMD TMJ Treatment Success. It is meant to clear up some misunderstandings and falsehoods and fairy tales about TMD treatment so that patients can get correct treatment and heal and get better. And the subtitle is How TMD is Really Supposed to Be Treated. So we have made incredible advances in science, and now we have a pill that cures all stomach problems. It's this yellow pill. You take the yellow pill, and no matter what kind of stomach problem you have, you are cured. So as science marches on, we now have another pill. Here's the pill that cures all heart problems. Doesn't matter whether you had damage in your heart or whether the heart's not beating correctly, whatever it is, you take this one pill and you are cured. And more. We have more. There are now pills that if you take one pill, that pill will cure all of your eye problems. It doesn't matter whether you need glasses or contacts or detached retina. Everything gets cured with this pill. And it is amazing. Dentistry has followed medicine in the pharmaceutical industry, and now we have a pill that will cure all your TMD problems, including, the ringing in the ears, the pain in the jaw, the muscle pain, the sleep problems, all the gastric regurgitation, everything related to TMD, the pain behind the eyes, everything is cured with these pharmaceutical pills. You just take the pill and everything goes away. So I hope by this time, listening to me, that you have figured out that this is a total falsehood. It's a fairy tale. There are no pills that cure TMD. And you can't take a pill to fix the problem, your TMD problem, because your TMD is not a deficiency of some pill. In other words, you with a vitamin deficiency, yeah, okay, you don't have the vitamin, you give the vitamin, you get better. But TMD is not a pill deficiency. TMD doesn't work like that. And so you have to understand TMD in order to get rid of the unwanted symptoms and all the problems that you've got. It's also really, really important to understand that the dentist can't heal you with his hands all at once. This is not, it can't be done. So many patients want 40 or 50 years of damage in their joints and their pain and sleep problems all to be healed in a week or two. That it didn't get that way in that shorter time, and it's not going to always be taken care of that way in that shorter time. We very often can eliminate most pain in the first 6 weeks, but TMD involves a lot more than just treating pain. So temporal mandibular disorders, TMD, what people commonly call TMJ, that is a ortho means straight, pedic means foot, straight leg, orthopedic problem. And what happens is when you break your leg, the surgeon, the orthopedic surgeon, puts the leg back into place the way it originally was and puts a cast on so that the leg will heal over time. This is a very important concept. And TMD is like this too. You can't say, take a pill. Can you give me a pill? Can you give me an exercise? Can you give me this? No. It's more that the upper jaw and the lower jaw are not related correctly, and there are a lot of problems. I can go over the types of problems. It just gets incredible. The number of problems that occur when the upper jaw and the lower jaw don't match, and particularly when the lower jaw is jammed backward into the ears and the tongue is carried back into the throat. There's just so many bad things that can happen, and you need to have some orthopedic appliance that will be worn in the mouth in order to heal and give the patient an environment of happiness where the body isn't being beat up. So every different patient is individual. It's so interesting. We are all different. You look at each of us and we have different faces and we can recognize each other because we're unique. We're not only unique facially in our body, but very often we're unique in our biochemistry. And what's really crazy about TMD is it is a disorder. It is not a syndrome. What does that mean? It means that people can come in with different symptoms and all have TMD. But we use an orthopedic appliance that I put primarily on the lower arch, and I believe personally that that's the best arch, and lower arch meaning the lower teeth. And if you look at it when you bite into it, it repositions the upper and lower jaws into a harmonious position so that the joints are no longer compressed, the joints are no longer being irritated, and then all the muscles can relax because they're trying to correct the problem. But you have to have an orthopedic repositioning appliance of some sort. My choice is a lower. And then we believe at the Atlanta TMD Institute that we need to teach the patient how to properly position the jaw in various ways so that the problems that come from jamming the joints will improve. So you can't just change your diet or have chiropractic adjustments, because if that joint is damaged, not in the right place, no matter how many chiropractic adjustments you have, it's not going to reposition the bite. That bite is not going to change from chiropractic therapy. So as I said, TMD is a orthopedic disorder, but it is not a syndrome. So if we look at these kids, they are Down's syndrome kids, Down syndrome. And what does that mean? It means that they all have the same signs, no matter which one, and it's easy to diagnose. You, even as a public person, could say these are kids that have Down syndrome, right? No question. But TMD is not a syndrome. What makes temporomandibular disorders difficult to treat is that a temporomandibular disorder is not a syndrome like Down syndrome. It's a disorder. And disorders come in different ways. It's like a teenager's bedroom is completely in disorder, and next week it might be it's the same bedroom in different disorder. Things are rearranged differently. It's disordered, and then 5 weeks later, same teenage room, disordered differently, right? So disorders can present to the doctor differently, right? They don't have to be the same. They're not the same. And so let's explore the some of the primary, not all, but some of the primary signs and symptoms of TMD that may be plaguing you. And the reason we have to do that, please listen, is because the orthopedic part is treated with the appliance, but there are other things that are involved in TMD that need to be also treated. One of my mentors was Brendan Stack, and he's passed away. He and two other dentists, Kidney Fund, so it's the Kidney Fund Stack Visual Index, and he put down some of the most common symptoms that people experience. And these are all the various symptoms. Let me tell you, but each person, each patient is individual and unique and may have, get this, may have some of this and some of that, may have some of the ear problems 4, some of the eye problem 1, and then different severities too. So it makes it hard to diagnose, that's number one, because it crosses over into different professions. So you see the ear problems might be an audiologist, it might be an ENT, right? The neck problems might be a physical therapist. The head and headache might be a neurologist. The eyes would be an ophthalmologist. And of course, the mouth would be a dentist. These are all different professionals who don't often, hardly ever, talk to each other. And so you have all of these signs and symptoms that you might be experiencing, and they all need to be treated. And they need to be treated very often slightly differently, with the only continuing, the only like consistent thing, an orthopedic compliance. So muscle pain tends to be the foremost complaint that people have. Pain related to muscles. As a matter of fact, paper was published, I guess, mid-80s, that proved or presented the fact that muscle pain is the number one overall factor in 90% of the cases. So when we treat patients, of course, we put a orthopedic repositioning appliance in. However, we want to treat the muscles. And how we do that? We want to address them by giving the muscles everything they love, like lots of water, some rest and good sleep, right? Calcium, magnesium, and zinc. These are things that, along with other things, vitamin C. And then we want to take away things that piss off muscles, like caffeine and nicotine and positional problems. But this would be one way of approaching the TMD treatment. Also, again, there's no pill. I told you, and everything mixed, because we have patients that come in honestly, and their greatest annoyance is the clicking and popping, right? Or maybe the ear symptoms, and they're not the same as all the other patients. So everybody has to be examined, and we do the treatment that we provide really is semi-customizable in that we address all the problems in a logical step-by-step sequence, right? So it's not just, hey, here's this appliance, go to the grocery store. No, that grocery store appliance is not custom made to put the upper and lower jaw in the position that's optimal for that particular patient. No, it isn't, right? Maybe it will stop the teeth from grinding against each other, and maybe it will unpack that joint a little bit. There might be some help, but that's not optimally treating that situation at all. So again, one, TMD is an orthopedic problem. We always start with an appliance. Then we go to things like, well, we know 90% of people suffer from muscle-related pain. Let's address those muscles. So one of the most important relationships in the body is the relationship of the skull, the jaw, and the cervical spine. The name cervical spine means the neck spine, the vertebra, the bones in the neck. And when you chew with your neck and your shoulders. You can go into a food court at a mall, sit and watch people eat, and you'll see they don't just go up and down like an alligator. Their heads kind of rock and on their neck, and their neck moves around. The neck is an amazing structure because all the commands that the brain gives to the body goes through the neck, right? And all the information from the body goes up through the neck into the brain. The neck is like a super highway. It's very important. Uh, and it focuses all the information up and down into that central hole at the bottom of the jaw, bottom of the skull. And the jaw, as it moves, changes the weight of the head on the cervical spine. So problems with the jaw is going to change the weight of the head, and which is going to change the position that the head sits on the cervical spine, on the neck bones. So I almost universally see neck problems with all TMD patients. So you're saying, well, doctor, what can I do for this headache? Oh, Lord Almighty. Well, the headache could be due to the jaw being malpositioned and the muscles trying to compensate. It could be because, you've got a forward head position where the weight of your skull is over forward and your body can't deal with this. All your neck muscles are hurting trying to stabilize it, right? There's just a lot of things that could be related to TMD in the neck. And so the neck does almost always have to be treated. So it's like, wait a minute, doc, when I say on a chat room, what can I do to help my headache? It's like, wait a minute, you've got so many things related to this headache that you're experiencing that okay, so you can take a pill and maybe decrease some of the pain, but that is not going to change all the problems that are within that neck, that are within that jaw, right? Or all the ringing in the ears. There's so many things related to TMD that it gets quite confusing even for doctors to understand it. But when we're treating patients, we are kind of peeling an onion, and we're going right after usually one of the main causes, the TMD, reposition of the jaw, right? Then we're going to take care of those muscles, and then after the muscles are relaxed a little bit, we're going to get into treating the cervical spine, the neck. There's just a bunch of stuff. And many of the patients that we see also have many other problems, right? Including thyroid problems, including prediabetes and diabetes, including fibromyalgia type things, which I have my own theories about, autoimmune diseases, other stuff too that are making things a problem. Most TMD patients have disturbed sleep, and it can be really minor disturbed sleep, or it could be what's called upper airway resistance syndrome, which is like not sleep apnea, but kind of like disturbed sleep where you feel tired all the time, to obstructive sleep apnea, mild, moderate, and severe. And most TMD patients, at the end of their 6 months of care, where we're resolving all these problems, their sleep improves, often to the degree where they don't need any additional like mechanical support like a CPAP if they comply. So sleep is extremely important. During sleep you release growth hormone no matter what age you are, and that growth hormone heals you, and you need that deep sleep. Now, REM sleep is more for emotional stability and long-term learning, but that deep sleep, like stage 3, 4 sleep, um, is in fact needed so that you can rehabilitate and fix all the problems in your body, right? That's where you rehab and heal. And that's why God makes us sleep. It's like, why would we want to lay down, close our eyes, and become unconscious while there are wolves and lions and tigers and bears running around that could eat us when we're asleep? I mean, there must be some really, really good reason for us to sleep. So disturbed sleep is extremely common in TMD patients. I actually gave a lecture at the Academy of General Dentistry meeting, and if you go into the professional section, professional playlist, I have an hour presentation on the relationship of sleep and obstructive sleep apnea. But we do address sleep at our institute because I want my patients to heal. It's not like, oh, just get rid of this pain, doctor. No, we want you to heal. We want your body to be peaceful, happy, and regenerative. Very important. So we have to address all of these issues in order to get you to be a whole human being. There's just so many what we call means the same, comorbid conditions that aggravate TMD, um, and it's important to address these also because these are what we call perpetuating factors. Perpetuating factors to perpetuate something is to make it continue, and patients who come in often have thyroid problems. And these thyroid problems often are not diagnosed with blood tests. So they're always being told, oh, you're normal. And they know they're not normal. Breathing problems, oh my Lord. These breathing problems can cause low blood oxygen levels and fibromyalgia symptoms and depression symptoms and a bunch of other things. Breathing is really, really important. Nutritional deficiencies that can cause dysfunction and pain in almost all of our bodies. And the food we grow right now, geez Louise, we've grown it on the same soil for 20 or 30 years. We've depleted the soil of its minerals and nutrients, and a lot of the food that we eat is just not really packed with any nutrients, right? Just primarily, a lot of them, carbohydrates. Insulin dysregulation problems. Oh my Lord, this is the most up and coming issue, I think, in TMD because the amount of weight that people gain, the insulin resistance that occurs, the general inflammation, particularly, well, why does the joint hurt? Because it's inflamed. Why is it inflamed? Well, it used to be able to tolerate the problem in the joint, but now it can't because there's prediabetes in the patient. There's insulin resistance, and now the patient cannot tolerate the joint problems because there's so much inflammation, not just in the TMJ joints, the TMD joints, but also in the rest of the body. Nasal problems. This is really, really interesting because if you can't breathe through your nose, where do you have to breathe? Through your mouth. You open your mouth, that's not normal posture, and that really pisses off the entire orofacial mouth area, let me tell you. But I can sit and talk about, geez Louise, so many other things, and those, we need to look at a patient as a whole, not just a jaw joint. So in other words, just dentists should not be plumbers. They're not like mechanics. We are actually physicians of the body, and we need to look at our patients not just as teeth, right? Or even as gums and teeth, or gums, teeth, and joints. They're people, right? They're humans, and the body is a whole. And osteopathic medicine, says this. And the body wants to heal. And I try very hard to create the right environment for the body to heal. And I try to address all of the problems that were pissing off the patient so that the patient can heal and do well, and a sense of well-being return to that patient. And also, I really, like a parent, I want my patients to thrive and do well and not have to come back to see me. I want them to be healthy. So I'm going to wrap up this video with some basic statements. Like first is TMD treatment is not simple, and you shouldn't be treating symptoms. So someone says in a chat room, how to get rid of this headache? It's like, oh my lord, that is a complicated matter, and they want a pill, and it can't be cured or really successfully long-term treated that way. There's no one silver bullet, the silver bullet that kills the vampire. There's no one silver bullet or magic pill that can correct all of the problems associated with TMD, because TMD is complex. There's lots of things associated with TMD. And it's also very complicated because patients present differently. They don't all present the same. And they have different amounts of different signs and symptoms. And it's kind of like different soups, right? With all the same ingredients, but different amounts. And it usually takes 3 to 6 months to heal. And during this time, 3 to 6 months, all of the accompanying comorbidities really should be addressed if you've got a clinician, a dentist who really is a healer and wants you to thrive. So again, this was brought to you by the Atlanta TMD Institute, and we are located at 1640 Piedmont Avenue, Northeast, Atlanta, Georgia, 30324. We do have a website, www.atlantatmdinstitute.com, and the telephone that we share with the Atlanta Dental Group currently is 404-874-7428. So until we meet again, God bless.